Hi guys, it's Dr. Galante. I want to talk to you a little bit about sciatica. And in some of my other videos, I go into some more detail about what it is and what causes it. But a quick review. Sciatica is when the nerve in the back is being irritated, usually by a disc herniation. And that causes the classic pain, numbness, and weakness down the leg. And sciatica is a very serious condition. And I wrote a book on sciatica. Matter of fact, I wrote a book several years ago because I got tired of seeing people come in my office who have been suffering with sciatica for months, years, not being able to work. They're on disability. They're on opioids. Their freedom's been taken away. They're losing their independence. They're not enjoying life. They're not living their normal, active lifestyle. And I don't want to see that happen to anyone, and I don't want to see that happen to you. So I wrote this book on sciatica called The Sciatic Survival Guide. And we cover several topics on it. One is the first, we talk a little bit about me, which really isn't that exciting, but it talks about how I got into chiropractic, my own back pain, my own times that I spent several days laying on the couch, that bed rest was recommended back in the 80s. We now know that's the worst thing for your back. So I've been through it. I know exactly what you're going through. I've been on the couch for 2 or 3 days at a time, 4 days at a time, more than once, which was the exact wrong thing to do. And I don't want you to get treated by outdated treatments that aren't effective for your condition. So as we go through the book, we talk about some of those myths about sciatica, about stenosis, lumbar degenerative disc disease, spondylolisthesis, how trauma can affect it, car accidents, how arthritis can affect sciatica. We talk about the other causes of sciatica. And we also, there's a big section on surgery. Is surgery the only way to treat sciatica? And in actuality, only 1 to 5%, depending on what study you read, of people with sciatica or back pain ever need surgery. It's a relatively small percentage. So 95 to 99% of people need chiropractic care for their back discomfort, for their back problem. And Mayo Clinic, and you can read this right in the book, Mayo Clinic, and I quote, back surgery is needed in only a small percentage of cases. And we've known that for a long time. Now, as we go through the book, we talk about your symptoms. Like, why does my back hurt in the morning? Why does it hurt when I sit? I'm not doing anything, when I'm just sitting there. Why does my back hurt when I can't sit normally? How about driving? How come I can't sit and drive comfortably? Why does it hurt when I cough or sneeze? And why does it hurt when I roll in bed or when I bend over? We talk about some home therapies, things you can do at home like ice, topical analgesics. And as we go through the book, we get into some gentle stretches. Obviously, when you're in sciatica, when you're in acute pain, you're not going to do a whole heck of a lot. But there are some gentle stretches that are helpful, that can help you get through the acute phase. We also talk about sleep positions. Sleep is very difficult when you're in that much pain. So we talk about laying on your back, putting a pillow under your knees. We talk about laying on your side with a pillow between your knees and ankles. And it's all in the book. We talk about that in more detail. We also talk about how to get up from a laying position and from a seated position. We also talk about how to get in and out of the car. These things sound like things we take for granted, we do every day, but when you have sciatica or severe back pain, they become very challenging. They become very difficult. So as we go through the book, we get to the section on what to expect when you come in our office. So first of all, when you come in or when you call, you'll be greeted by a friendly staff, and we'll get your information. We'll get you scheduled for a consultation at a convenient time. And when I come in, we're going to talk about your condition. What's going on? Where's the pain at? What caused it? Have you had this before? What have you tried so far? What doctors have you seen? And we'll go over your history. Then we'll see about getting imaging, either getting some of your old imaging that you had or taking some new imaging, x-rays, MRI, whatever we need. Now at this point, once I review your exam findings, review your imaging, if I don't think I can help you, or I don't think our treatments are a good fit for your condition, we're going to point you in the right direction, help you find something else that can. Now I work with a lot of local therapists, pain management doctors, orthopedic surgeons. Truth is, vast majority of my patients never need to see those doctors. But if you do, I'll be the first one to tell you. Now, if I can help you, what we'll do is we'll put together an individualized treatment plan for you. We'll talk about what we're going to do, how long it's going to take, what it's going to cost. And you'll know all that before we start treatment. So if you or a loved one are suffering neck, back pain, low back pain, sciatica, disc herniation, stenosis, give us a call. Let's do our consultation. Let me see if we can help you. If we can help you, great, we'll move forward. If we can't, I'll point you in the right direction. Thanks. Be well.